Infections in Belgium are fueling calls for a second lockdown. The virus has also hit a key politician in the country. Former Prime Minister Sophie Wilmès has been admitted to intensive care after testing positive. Well, for more on this, let's speak to our political editor, Darren McCaffrey, who is joining us from Brussels. Good evening, Darren. You know, Belgium was one of the worst hit countries during the first wave of the pandemic. How concerned are the authorities in Belgium about this second wave?
Really concerned indeed, and we've seen a dramatic increase, not just in the number of cases, but hospitalisations here in Belgium in the last couple of weeks, Oliver, most notably here in the capital, Brussels, but also in the south in Wallonia, Liège, one of the key cities there in Wallonia, suggesting that it is now full of coronavirus patients and is turning people away. People here in Belgium are referencing it to Bergamo, you may remember in the north of Italy, when their hospitals were overrun. Suggestions that Belgium is now on that tipping point. Maybe unsurprising then, given that thought process, that the government is looking at adding further restrictions. You have to remember they only closed down restaurants here and put on further limitations on people's movements at the start of this week. A meeting that was due to be held tomorrow has been brought forward to this evening. Almost inevitably further restrictions will be added. And as you have pointed out, this comes on the day that we found out that Sophie Wilmès, who was Prime Minister of Belgium up until the start of this month, had seen the country through the coronavirus pandemic. Well, she herself has ended up in hospital, in intensive care. Her doctors are suggesting that we do not need to worry at this stage, that she's fine, she's been looked after. But this is only 5 days into her testing positive and showing symptoms. There were suggestions she may have picked up this at an EU Foreign Affairs Minister. She's currently the Foreign Affairs Minister for Belgium last week, which the Austrian Foreign Minister also tested positive. She thinks it was more likely that she caught it in her home. But it is a reminder, of course, that this virus can infect anyone, that everyone is exposed. And also, it must be said that she's only 45 years old. Lots of messages of goodwill coming from politicians here in Belgium and beyond today, Oliver.
Darren, at least 11 EU member states have recorded their highest number of new infections within the last 24 hours. So how is the bloc responding?
Yeah, real concern, isn't there, clearly about this second surge. There really isn't a part of Europe that has not really been affected and indeed infected. It must be said that actually, while there's been an awful lot of focus on Western European countries, as you've noted, France and Spain and elsewhere, it really is in the east, which wasn't badly affected first time round, where there is most concerns. Particularly the Czech Republic, which has got the highest now infection rate in terms of growth per capita anywhere in Europe. And also in Poland too, that's been hardest hit. We've seen record numbers of hospitalisations, cases and deaths in both countries today. The EU stepping in, given the criticism that we found first time round about it not reacting quickly enough. Ursula von der Leyen, the Commission President, announcing today that 30 ventilators would be sent from Brussels that were procured during the first wave of this crisis and sent to Prague to try and help out there. There has been a military field hospital set up on the outskirts of that city to try and help out. Also talk that much of the additional money that had been set aside is now going to be distributed to countries like Poland. But there is real concern, given the level of healthcare and hospital equipment, along with doctors and nurses, that countries in Central and Eastern Europe haven't got the ability to quite cope as Western European countries have. And there is a concern that, again, they are on a tipping point where their hospitals essentially get overwhelmed, and where people who may well have survived this deadly virus may succumb to it, simply because doctors and nurses will have to make choices between who lives and who does not.
Thanks, Darren. Darren McCaffrey.